Preschoolers are 3 times more likely to require upper respiratory support than those that stay at home. Not only does this affect the child, but affects the parent who may have to stay home with their sick child. Dr. Nigel Plummer, an expert in probiotic research and development, is here to discuss the clinical trials and the effects of probiotics on upper respiratory support. Dr. Plummer, can you tell us a little bit about the research that was conducted on this?
Yes, this is a trial that we did with children between 3 and 6 years of age. And we did it over the winter period, so during the fall term at school and the spring term at school, so from October until March. And we gave them one group probiotic daily for that 6-month period, and the other one not. And what we found at the end of that was that the upper respiratory tract health of the probiotic group was significantly better than the ones who weren't taken probiotic. And so we had a 50% improvement in upper respiratory tract health in the probiotic group compared to the placebo group. Not only that, if you look at the number of times that the upper respiratory tract health was challenged during that 6-month period, then again we got a 30% decrease in the probiotic group compared to the non-probiotic group. And then more. What we found was that when we measured absenteeism from school, then the children who were on the probiotic group, 33% decrease in absenteeism from school. And of course, when kids are off school, then mum or dad has to take time off of work, or grandma or somebody has to take time off work. So that really resonated with parents. More than that, what we found was that when we looked at visits to the doctor, that was also decreased by 40%. And when we looked at antibiotic use, that was decreased by 40% too, which I think is a really important piece of information. So in terms of improving upper respiratory tract health, we could definitely see that, and we saw the effects of that, not only in terms of the actual health of the kids, but in other outcomes, such as absenteeism, visits to the doctor, antibiotic use. And I think that is, it's a groundbreaking piece of information and trial. But oddly, it's not the first time. Probiotics have been shown in over 20 trials now to be able to improve upper respiratory tract health by an average of 30%. So probiotics are beginning to be seen as being the intervention, if you like, for this type of thing, whereas previously we would typically think of things like vitamin C or zinc to improve upper respiratory tract health. Now I think that the pendulum is swinging. Now probiotics are being shown to be far more effective.
So this is really encouraging news. What could be a possible mechanism of action for the probiotics affecting health?
Right, well, what we understand is that our microbiome primes our immune system throughout our lives, and it primes our immune system to do the right thing. And probiotics are simply the best components of our microbiome. So what we think is going on here is that it's just that the probiotic is priming parts of our immune system that basically protects upper respiratory tract health, upper respiratory tract function, and supports immune function overall. So, and that might be improving our white blood cell count, it might be improving the functionality of our white blood cells, or other aspects of our immune function as well.
So supporting immune function through probiotics is clearly important. Is this something a parent could use as a strategy with their child on a daily basis?
Yes, I think from our trial we had these kids on the probiotic through the winter period. And it's during that time, I mean, most people are challenged, and kids challenged from upper respiratory health point of view during the months of November until February. They're the peak months during the year. So we would absolutely suggest that probiotics are used during that time. But also from our trial point of view, we ran it for 6 months. And that's an extended period of time. So probiotics can be used and maybe should be used on a daily basis to simply have a continuous impact in improving immune health.
When looking for a clinically researched probiotic, ask your healthcare provider, your pharmacist, or visit your specialized health food store.